I'm Dr. Randhir Kumar, Senior Consultant Neurosurgeon and Neurointerventionist at Continental Hospital. Today, I'm going to discuss certain important things and nuances of brain strokes. In general, we divide this brain stroke in two parts, commonly as a hemorrhagic stroke and ischemic stroke. Hemorrhagic stroke, where there is a, common terms, there is a brain hemorrhage or there is a leaking of blood inside the brain. It's maybe due to the multiple causes. And second part, where there is a obstruction of blood flow to the brain, we call as a ischemic brain. So today I'm mainly emphasizing on the ischemic stroke, or where the blood supply to the brain is interrupted and leading to the cerebral or brain stroke. So now commonly, what are the causes of this stroke? As everyone know, we have regarding the cardiac or cerebral. Cofactor or developing factor for both this stroke, either it's a heart attack or heart stroke or brain stroke, are similar. Diabetes, which is uncontrolled, hyperlipidemia or lipid or cholesterol profile is not controlled. Third, excessive smoking. And fourth is a lifestyle, where there is a paucity of your activity, there is not much exercises, your job profile, stress factor, and there is some other metabolic factor where we feel low vitamin B12 leading to the hyperhomocysteine level, and some other factor where due to the cardiac problems the cerebral stroke develop. In the cardiac diseases where some rhythm of the heart is not good, we call it as arterial fibrillations, in which type of patients, those who are not on anticoagulants, they can develop this type of cerebral stroke. And second, cardiac patients who has been operated for the valvular heart disease like the mitral valve or aortic valve replaced, and those who are already taking this anticoagulants tablet or antiplatelet tablet, but suddenly this stop. In that cases also, some clot from the heart will go to the brain and can develop to the stroke or cerebral ischemic strokes. Now, how we know that it is a stroke at home? If you find out your family member or anyone that he or she in the AZ group with such a comorbid factor suddenly develop, there is a weakness of the hand or leg, or changes in the speech like slurring of the speech to the complete cessation of the speech. Apart from that, there is a giddiness sensations, vomiting, or maybe the chances that there is a sudden seizures, we call it a fits or unconsciousness. This all kinds the primitive symptoms of the acute stroke. There are many of the patients we have seen, there are warning signs, we call as the TIA or transient ischemic strokes, where there is a mild changes in the hand, slurring the speech, or the face numbness occurs, but these symptoms immediately within I think 1 hour or 2 hours time it subsides completely. So these are the warning signs, and those who have not taken care of these warning signs, in them the fulminant strokes develop after a certain period of time. So we call as a FAST, F-A-S-T. F is for facial asymmetry, A for arm and leg weakness, S is for speech, where speech symmetry, slurring of speech or complete cessation of speech, and T is the most important, that is the time. Time is a very important factor for the brain strokes. Every minute we lost the million of neuronal cells which is deprived of the blood circulations, which takes the oxygen from the heart, it's not reaching to the brain and the neuronal cells start dying. So the time is so important, where we called as initial golden period. Initially 3 hour to 6 hour time is a golden period of the acute stroke. Now there is a multimodality treatment of this acute stroke, where when they're reaching within the times, we have the clot busting agents, we call it the TPA or any other agent, we give immediately so that we can plan it out for our interventions work. There is a now vital role, or we call it as a gold standard of stroke treatment, is neurointerventions. And what is neurointerventions? It is as similar as anybody is going for the cardiac stenting or cardiac angioplasty. And that's the same way we reach from the either groin or from the hands vessels. From there we pass small catheter to the brain, to reach that area where the blockage is due to this embolus or somewhere which is causing the ischemic strokes. So what we do, we have aspiration device, we call it as a penumbra aspirations, or apart from there other multiple balloons or stents are there, by virtue of which we can re-establish the circulations. And these all patients, those who are coming within the time with the hemiplegia, means weakness of hands and leg area, which our speech, I think majority of them improve within hour of the interventions treatment, and they can be safely discharged without any comorbidity, weakness in the hands and leg or speech. But yes, majority of the patients, those who are developing this stroke, are not being reached to the tertiary care center where this neurointerventions can be done. Majority of the times we have seen the patients are being taken to the smaller setup hospital where initial investigations or initial treatment is being done, but not at par to give any neurointervention services. So vital time of our 3 hours or 6 hours is spent at the minor hospital or minor nursing homes, and whenever this type of patient reaching to our hospitals, they are beyond the time of neurointervention zone. In that cases, there is hardly, we know that this patient is now this infarct is established already, so hand and leg with weakness or paralysis, we can't revert back. In that type of cases, we have to do some other sort of things with a life-saving operation. We call as a decompressive craniotomy. We are putting some bypass shunting, but not as even the patient is survived, there will be disability of lifelong. Lifelong, he will be either on a wheelchair, on the bed, or even will not survive. So it is very, very important to know the timing. Whenever in your family you have seen that any suspicious of this stroke, get it to the tertiary or best care center where the interventions work is being done, so that the patient's neuronal cells will be saved and the patient disability and the morbidity and mortality can be saved as maximum possible.